is your date of birth? Okay. Alrighty. So that makes you a Sagittarius. Okay. No, we definitely need that for medical purposes. Absolutely. It is imperative to your test result, actually. Yes, you know, where the moon was in the sky when you were born and all, definitely could affect your cranial nerves. Yeah, a lot of people didn't know that. Very interesting stuff, I know. Well, in any case, let's go ahead and move on to our questionnaire portion. So we are going to be testing your taste today. I just wanted to make sure that there weren't any foods that you were maybe avoiding at this time, any certain scents that you have an aversion to. The point is to test for acuity. I'm not trying to completely disgust you here. So if there's something that you really have a strong aversion to, I would like to avoid it if at all possible. Okay. Yeah. Yeah, that's totally understandable. I do have those scents and tastes on hand, but we can just put those aside. We won't even bring them out today. Yes, I would like to be as respectful to you as possible. There are portions of the exam where I will be putting my hands on you, such as the touch portion. Is it okay? Do I have your consent to touch you today? Perfect. Okay. Thank you so much. Well, I think that is all of the preliminary questions I have for you today. If you don't mind, you could step this way and we will get started. Perfect. Okay, so first things first, I am going to be testing your vision. We are going to be focusing on the optic nerve first. So, for our first optic nerve exam, I did want to go ahead and just examine your eyes physically really quickly. I'm just going to take my little light here, shine it into your eyes. I hope you're not too sensitive. Okay. Just taking a preliminary look here at your eyes. I did just want to see how everything is contracting, expanding. Make sure pupil dilation is peak and up to par. Okay. So far everything is looking very good. Alright, I'm just going to get a little bit closer to you now if you don't mind. Perfect. I'm just going to take your eyelids, open it up just a little bit, and I'm just going to take a look in here really quickly. I just wanted to look, make sure that there is no dryness in your pupils. Yes, just make sure there's no irritation. Have you been experiencing any sort of itchy eyelids? None of that. Okay, no dry eye. How has your tear production been? Normal. A little bit more than normal lately. Yeah, I feel like that is the common consensus for most people today, myself included. Alright, next we are going to test your vision with this eye chart here. Okay. So what I want you to do with this is take a look at it. I'm going to ask you to read off each of these letters here. Alright, we're going to start up at the top with the easiest one first. Could I have you I just want you to focus on my nose right now, okay? I'll let you know when I need you to look at the light, okay? Just focus on my nose. Focus on my nose. You're doing great. Yeah. Perfect. You're doing such a good job. Awesome. Just focus on my nose. Beautiful. Good. Good, good, good. Perfect. Good. Alright. Now I would like you to focus on the light, okay? Focus on the light. Look at the light. Don't look at my nose. Don't look at my nose. Just look at the light. Just look at the light. Don't look at the light. Don't look at my nose. Look at the light. Look at the light. Don't look at my nose. Look at the light. Look at the light. Good job. You're doing great. You're doing an amazing job. You're doing so good. Good, 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 good. Yes. I'm just gonna start moving it a little bit more erratic. Yes. Just wondering if you can follow. You're doing great. Good, 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 good. Okay. Perfect. Can you follow the pattern? No, that's okay. Do you know what's coming next? No, I didn't see that coming. Okay. Perfect. Good, 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 good. Alright. Next thing we're going to do, I'm going to hold up my fingers and I want you to tell me without looking at my fingers. Keep your eyes on my nose. I want you to tell me how many fingers I'm holding up, okay? Beautiful. How many fingers? Good. 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 Great. Perfect. Good. Good. Great. Good. Good. Okay. Now I'm just going to have you follow my instructions, alright? I would like you to tilt your head up, look up for me, up, 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 up. Good, and look down, 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 down. Good, look up, 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 up. And down, 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 down. Look off to the left for me, all the way, turn your head. Beautiful. Now look all the way to the right for me, to the right, to the right. Good, 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 good. Okay. Everything looks good. Okay, you can look straight at me again. Okay, tuck your chin into your chest. Chin to your chest. Okay. Alright, now look all the way up towards the ceiling. All the way up, all the way up. Alright. Alright, now focus straight back on me again. Good. Alright, now without moving your head at all, look to the left. Perfect. And look to the right. Without moving your head, without moving your head. Okay, for this next test, I'm just going to be asking you either the color or the shape of the object on the card, alright? Let's begin. Perfect. We'll start with this one. What shape is this? Beautiful. What color is this? Good, 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 good. What shape is this? Good. And what color is it? Good. What shape is this? Beautiful. What color is this? Perfect. What shape is this? Good. How many stars do you see here? Good. How many bumblebees are on this picture? Good. How many bananas do we see? Good, 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 good. Then how many airplanes? How many airplanes? Good, good, good. Perfect. And then for our next test, I am going to be testing your color blindness, okay? I'm just going to be putting these filters in front of you, and I want to know if you could tell me which color you see. sort of notes with that one? Yes, that is coconut. Honey as well. Oh, did you say bergamot? Yes. It does have a little bit of a woody scent to it, yes. That could just be the wood wick in there. Beautiful. Yes, I'm not going to tell you actually the scent of the candle. I am just testing to see if you guess the notes correctly. Then I'm going to type this in my notebook as well. Here is our second candle. Go ahead and give that one a sniff. Yeah, cinnamon. Correct. Spiced vanilla, very specific. Yes, you're correct. And a Parisian cafe, you say? Absolutely. You have quite the nose on you. Our last candle. Go ahead and give that one a whiff. Jasmine, yes. Perfect. I dare say you must have been a bloodhound in your past life. Yes, with a nose like that. Well, this next test should be nothing to you then. I have a few bottles of our own blend of essential oils that we make here in office. So I'd just like you to take a, once again, quick sniff and see what notes you're picking up on. I'm just gonna hold this underneath your nose really quickly. Could you tell me what you're smelling with this one? Oranges, perfect. And then how about this? Are you getting any sort of notes with this one? Lavender, perfect. How about this one? Sage, yes, good job. Very good job. Alright, last you more of a salty or sweet fan, by the way? Yeah, me too. Yeah, there is just something about a salty snack that hits right, doesn't it? Alright, go ahead and hold out your tongue. Taste that one for me. What are you tasting? That is right, salt and vinegar. Yes, salt and vinegar chip flavor. Yes. Perfect. Alright, okay, so this next portion of today's exam is going to focus on your trochlear nerve, which is going to go down your shoulders, arms, and torso. It extends all the way down the torso and focuses on your sense of touch. Yes, that is correct. So, I am going to be putting a few items along your cheeks and also in your hands, and I will be asking you whether you feel a hot or a cold sensation, whether you feel a smooth or a rough texture, things like that. Does that sound good to you? Okay, perfect. So, first things first, I'd like you to close your eyes for this portion of the exam, alright? Yes, no. We cannot have those eyes open. We are focusing primarily on your sense of touch. Perfect. Go ahead and close your eyes for me. Are they closed? Okay, good. So I am just going to pop on just a little tool to help me today. Alright, I'm going to be touching the sides of your face, okay? Alright, so alright, was that first touch textured or smooth? Textured, good. We're gonna do that again, okay? Alright, the first time I touched you, was that textured or smooth? Smooth. And once again, was that textured or smooth? Textured, good. Again. Was that textured or smooth? Smooth, good job. Alright, I'm going to pop these off. Keep your eyes closed for me. Do not open them. Do I see you peeking? Okay, no peeking for this portion of the test. Alright, and for our next, I am just going to be touching you lightly on the face, and I'd like you to tell me whether you feel a sharp poke or a smooth, soft brush, okay? Alright, so good. Poke. Brush. Yep, sharp. Soft, good job. What was that? Sharp. Soft, good job. Sharp. Sharp again. Soft, good job. Sharp. Sharp again. Good job. Soft. 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 Good job. Sharp. Sharp. Soft. Good job. Good job. That was perfect. Next, I want you to, I'm gonna have you keep your eyes closed. I have in my hands two sensors. One sensor emits a warm, warm feeling. The other sensor emits a colder, much icier feeling. Right? I'm going to press them to your face one at a time, and I want you to tell me whether you feel hot or cold. Does that sound good? Perfect. Okay, here we go. Are you ready? Hot. Good job. Cold. Good job. Hot. Good job. Cold. Good. Cold again. Good. Hot. Very good. Cold. Good. Hot. Good. Hot again. Cold. Hot. Very good job. Very good job. Alright, next I want you to hold out your hands for me. And I'm going to put two objects in your hands. I want you to tell me which one you feel is a solid or a liquid, okay? Perfect. Alright. Hold out your hand. Solid. Alright, and hold out your other hand. That is a liquid. Correct. While you're holding out your hands for me, I am just going to place my hands in yours, and I want you to tell me whether you feel a firm or a soft pressure, okay? So I'm just going to press down. Firm pressure, perfect. And now, light pressure, awesome. Once again, I'm just going to press down. Firm pressure, correct. And once again, light pressure, awesome. Alright, I'd say everything is perfect there. Let me just jot that down in my notes once again really quick. Yeah, you passed that one with flying colors as well. But are we even surprised at this point? You're literally knocking it out of the park. Yeah, no notes honestly, except for these. Alright, perfect. Well, it looks like we are ready to move on to our last and final test. Alright, well, head over this way and we will get you into our next testing facility. Okay, so the last portion of today's testing today is going to be your hearing test. So, I do have some headphones here for you. I did want to just put these over your ears really quickly, and then we will be testing your hearing. You will hear a beep on either the left side or the right side, and I'd like you to tell me by raising your finger with the according side. So if you hear it on the left side, raise your finger on the left. If you hear it on the right side, raise your finger on the right. Does that sound good? Okay, perfect. I'm just going to get these headphones put on you now. So just come excellent on all of those tests. Yes, I am thoroughly impressed with you. I'm just gonna put in my final notes here. Okay, perfect. Well, thank you so much for coming in today. I hope you enjoyed your cranial nerve exam. We will keep a thorough document of all of the testing that we did on you today. Yes, if you ever want to come back for a more in-depth test, seeing as this was our first test together, we were just kind of